At Healthwatch Coventry, we make sure that people's experiences of health and care are heard. Part of our work is to hear the voices of those least heard. To do this, we worked in partnership with Working Actively to Change Hillfields, a community organisation in Hillfields, and Hills FM, a community radio station, to hear the voices of local young people and their experiences of health and social care. Here are some of their stories.
Into the doctors, and they were actually really nice. I do feel comfortable discussing my health concerns with healthcare professionals. Don't be afraid because the doctors and nurses are really nice. I've not encountered any stigma or judgment while seeking healthcare from the NHS. Honestly, there are no improvements that I can think of to improve the NHS. It's amazing as it is. I think there should be more like PSHE lessons on how you could access the NHS anonymously, because a lot of people don't like telling their parents about things, so they just deal with it but they actually need the help.
I am 13 years old. I don't really believe the NHS can improve on anything because they are really good at doing their job and all that. One of the experiences I've had, it was really quick and they've done it really good. I have felt hesitant or unsure about seeking medical help because I don't really trust anyone that much, so I don't feel like I can talk to people. I would say it would be much better for the NHS to use technology, as like young people might not feel like safe or they don't want to know what people they look like. I would give like advice saying you could try book an appointment with like a friend of yours that you really trust so they could help you get through with it.
They saw like a little rash here and were like, oh, that could be a life-threatening disease, which honestly made me really worry. Then he got me into an ambulance and sent me to the hospital. I had to wait around 5 hours all by myself, waiting for him to get to there. When he did give me the shots, he gave me the choice, but because like at that time I was worried, well, do I have a life-threatening disease? I said sure, because if I don't, who knows, I might die. I mean, I feel like they should at least explain to their child what's actually happening. I'm now 15. Literally, when I was 14 below that, I didn't even know what Samaritans or any of the other ones were. I feel like it needs to be like posted more around like places, like with the numbers up, so then people know what they are. They don't teach about any of that at school. No PSHE lessons or anything.
I was very confused with some of the terminology they were using, but thankfully I had my mother with me. But I do feel it'd be much easier to put it in simple terms, if that makes sense. The whole process of diagnosing a child is very tedious and difficult, especially for the young person. I have in school access to mental health support through the NHS. I did have someone come in to speak to me and discuss on certain strategies. It was quite positive. I would have liked if it would have lasted longer because it was an 8-week program. Before I turned the age of 16, I would have to have a parent or guardian with me at the time. But now, as I'm 16, I do get a bit of freedom with that.
These stories show us a snapshot of voices and experiences of these young people and what they think. They think very highly of the NHS, but there are worries about having control over their health and mental health, especially if they think parents could or should be involved.